So we do have a lot to cover on today's agenda. So Marco, I'm going to pass it right over to you and to kick us off with some opening remarks.
Thanks, Sherry. Good afternoon, almost noon, everyone. How's everyone doing today? Can everybody hear me okay? Good to hear. All right, as Sherry said, I'm Marco Giordano, your CEO, and I thank you all for joining us again today. So this past weekend was a weekend of great reflection. I'm certain that we all, in our own ways, reflected as together as the country marked the 20th anniversary of the 9/11 terrorist attacks. And amongst the pain, the suffering, and trauma caused by the horrible events of that day, we also saw the feelings of unity and pride as Americans came together to support one another in the moment, as well as afterwards, to recover and move forward. As I reflected this weekend, I was reminded of our organization and our resiliency when we are faced with adversity. Our resiliency is grounded by our foundation of value of respect for the dignity and worth of every individual and the belief that together we're better. So as we continue to work through the challenges, the big ones and the small ones that each day brings to us, let's also continue to work together. Let's support each other. Let's check in on each other. And let's be there for one another, even if by simply sharing a smile. This is exactly what our DSPs do every day. Through the amazing support, care, and compassion for the people we serve, our DSPs have navigated and continue to do so a time when balancing personal resiliency and that of others has been difficult. But as we have seen in the past, and as we have seen during the pandemic, the unwavering commitment of our DSPs prevail. As we kick off DSP Recognition Week this week, a huge thank you goes out to all of our DSPs for the sacrifices they've made and the amazing work you do each and every day, all in the spirit of kindness and love. So thank you to all of our frontline DSP workers, and please join me in giving all of our DSPs a round of applause. Before I pass the mic back to Sherry, I did want to share some additional thoughts. As many of us know, as probably all of us know, because I'm sure we're all in some form or another paying attention and staying in tune to what's happening around us. The past couple of weeks have been pretty active as it relates to COVID-19 vaccine mandates. Most recently on Thursday, the president announced a 6-pronged plan to continue the fight against COVID-19. And within this plan, the Department of Labor's Occupational Safety and Health Administration, OSHA, will be and is developing a rule that will require all employers with 100 or more employees to ensure their workforce is fully vaccinated, or require any workers who remain unvaccinated to produce a negative test result on at least a weekly basis before coming to work. In addition, the Centers for Medicare and Medicaid Services, the agency we all know as CMS, is taking action to require COVID-19 vaccinations for workers in most healthcare settings that receive Medicare and Medicaid reimbursement. Both of those paths that are reflected in the president's plan impact us directly. And while the details of these mandates are unknown at this time, we do understand what the city of Philadelphia and the state of Delaware are currently requiring. So today we will be sharing further insight into those mandates. However, it is important that we all stay aware and be aware that vaccination mandates could quickly become the norm across the country, whether they're mandated by federal, state, or local government. In preparation for the mandates, we will be asking every employee that has been fully vaccinated to submit information via a secure online application that we will be reviewing with you today. This week, we'll also be sending out communication regarding this request to the larger community. However, your assistance in participating as a participant in today's call, in sharing this information with your coworkers is always appreciated and needed. So we will continue to pivot and adjust to comply with mandates and other support that is needed during this time. And again, I thank you all for doing what you're doing to keep yourself safe, the people we serve safe, and your family safe and healthy during this time. With that, I'll turn the mic back over to Sherry.
Thanks, Marco. And I'm going to ask Sarah to pull up the agenda again because we do have a lot of people that have joined us. I think this is a bigger meeting than we've had in a while. It's like everyone to have a glimpse. So Linda is going to give us an update on the Hurricane Ira relief. Brian will, as always, take us through the COVID numbers. And then, as Marco mentioned, we're going to be talking a lot about the vaccine. So you'll get a demo around the form, and we'll talk about the vaccine exemption form and then details about the Delaware mandate and the Philadelphia mandate. And we will open it up for Q&A. I do want folks to know we already got a lot of questions via email and your voice. We've categorized them. So we probably will start with those because I suspect many of those questions will answer what's on your mind. But of course, we will open it up to your questions. And as always, you can do that through your voice. Sarah will be monitoring that mailbox. You can send it to her personally. You can use the COVID-19 mailbox, and then of course the Zoom chat and the raise hand function. So we certainly do want to get all your questions, and as always, when we can't answer the question, we'll be taking note of them. This is recorded, and we will do our best to, get back and clarify anything unanswered. So with that, let me turn it over to Linda to talk to us about the Hurricane Ida relief. Linda, I know I saw you there.
I'm here.
Great.
Thanks, Sherry. Yeah, hello, everyone. It's so great to see so many of you here today. And even though, we always focus on COVID as the majority of our content, we did want to really take some time to talk about Hurricane Ida and the subsequent storms that also reached the East Coast for a lot of our staff and our participants. So we wanted to give you an update on how our RHD community in Louisiana is doing, as well as just some steps that the RHD itself has been trying to do to support and encourage each other along the way. Sean Randall, our service line director in Louisiana, couldn't be here today, but she shared some important steps that are being taken and just things that we are trying to do to support each other. So wanted to first just talk about many people, many of our staff participants in New Orleans had to evacuate. Many people were without power for more than 10 days. There was no services there. Some people had quite a bit of damage. And right now there's a lot of people that are starting to come back home. People that had to leave and are being able to come back to their homes and clean out and rebuild. And we want to make sure that we as an RHD community are just doing all we can to support them through this difficult time. Also, many, as we talked with Sean and Jan and Matt and other leaders in Louisiana, a lot of people had memories of Hurricane Katrina. And so this storm in particular, many of the things were the same. And so we wanted to, just acknowledge that and keep that in mind as people are really trying to rebuild. So some of the things that on the ground we were able to do to try and support our staff and participants there. Initially, very quickly on, a team site was created for all of the staff to share local and national resources together, A lot of people were without power and phones. So we really tried to figure out a way, how could we be in touch with everybody and keep people updated on what was needed and what was available. Heart to Heart was able to make available to every Louisiana employee a fund, a gift from Heart to Heart, in addition to those with catastrophic situations where they needed to rebuild, can also apply for an individual Heart to Heart donation. Helping Hands was immediately available and continues to be available to anybody that is interested or would like to have a referral. The PTO bank that really we were able to start in the beginning of COVID, that people donated PTO days to those that were affected, was also available to staff that might have been out of PTO. All staff are still able to make PTO donations. If you would like to reach out and help your Louisiana staff members and part of our community down there, as well as Heart to Heart. After this meeting, we can send that again. I know Marco sent last week a way to become a member of Heart to Heart for as little as $1. And you can see the tremendous impact that those little bits of donations have added up and been able to assist each other in our time of need. So that is it for today. I know that if anybody else has questions around that, please feel free to reach out to me or to Sean, and we will keep you updated. So thank you, Sherry. That's my update for today.
Great, thank you, Linda. And I'm going to pass it to Brian to take us through the COVID numbers.
All right. Thank you, Sherry. Good afternoon, everybody. Currently, we have received 2,929 reports since March of 2020. 826 of those reports have been confirmed cases of COVID, 1,511 negative reports, 81 suspected reports, and 499 possible exposures. Now, currently, we actually received about 10 more reports this morning that relate to last week that have not yet made it into our numbers for this week. And we expect we're going to see a little bit of lag, anyway. So we'll be seeing more of those numbers the next time we meet. So at this time, I'm going to share my screen and show you the bar graph that we've been looking at. And it's going to show us a few things. The thing that we really see is that the last 2 weeks of August were quite active, as well as the first week of September. So we can see that those numbers were high. And, in there were 22 confirmed cases in August for COVID, and we're waiting for updates on the suspected and unknown cases. So that number could actually grow in the subsequent weeks. In looking at these numbers also, you can see, it was pretty consistent in these 3 weeks, and you'd have to look back to July 24th to see that next week where we really saw quite a few reports come in, and then even further back to April 17th, where we saw a good bit of reports come in. So, we see those, one-off spikes, but August has been, pretty consistent in the numbers that we've received. So also, the next time we meet, we're going to have some more interesting data as well. We should see more of perhaps the impact of Labor Day as well. The further we get away from Labor Day, to see if we've developed any positive cases or any additional exposures. The next part, I usually talk about the national perspective as well. And, one of the interesting things I saw this morning was that coronavirus deaths actually have been on the rise in the United States, even though hospitalizations and new reports of and new cases have actually started to level off a bit and decline slightly. We saw the South and the Midwest really have that summer surge, and they've started to level off. So, I guess that's encouraging at this point, but we'll have to, continue to monitor that and really see how that goes. But in the meantime, for us, we really need to stay vigilant and just make sure that we're continuing to follow our practice, our safety measures to keep ourselves, our families, and the people we serve safe. Go back and refer to the protocols that were updated in early August, and they will help guide you and keep you safe. And Sherry, that is all I have for today. So I'm going to hand this back to you.
All right.
And I'll stop sharing.
Yes, thank you, Brian. So while
There
you're
we go.
doing that, I just need to recognize that I swapped the agenda. So just to clarify, next, Bernie's going to walk us through the Delaware mandate. And then Alicia will walk us through the Philadelphia mandate. And then we will have the demo around the vaccination form. So my apologies if my agenda was off today. Additionally, as folks do their presentation, they are going to try to answer those questions that came in. So we're going to try to cover as many of those, but we'll make sure that we are touching on all the topics. So Bernie, I am going to share my screen so that you have the presentation that goes with the Delaware mandate.
Okay, thanks, Sherry. So
Let's see if I can do that right.
Okay,
Fingers crossed.
start, Sherry, while we're doing that, because I know we have a packed agenda and I have talking points that are a little bit in addition to the slide that Sheena was kind enough to put together for us. So you know, piggyback on Brian's report, the state of Delaware has reported a large increase in the number of positive COVID-19 cases with specific reference to consumers and staff, both on the DSAM, the behavioral health side, and on the DDDS side, our IDD funder. On August 16th, Governor Carney and the Delaware Department of Health and Social Services announced that beginning on September 30th, staff in long-term care and other healthcare facilities in Delaware will be required to provide proof of vaccination or to undergo regular testing to prevent the transmission of COVID to the vulnerable populations in the state of Delaware. This emergency governor order currently applies to RHD's residential community homes that support either those with an IDD or a behavioral health challenge. As it is written right now, this current governor's order does not apply to our ACT or our ICM teams. Okay. Our understanding of the emergency order from the governor requires that each staff provide proof of vaccination or weekly COVID testing with negative results to remain eligible to work past September 30th. I do want to stress that this is our current understanding. This is a very fluid situation like it is in Philadelphia and in Jersey and other places where we're doing business, and it could change. We are still currently waiting on the governor and the Department of Health and Social Services to give us their written mandate. They've provided us an outline, they provide us some talking points, but we don't have the formal emergency order in hand yet. We want to reinforce the idea that the vaccination is free of charge and is available in multiple spots. The testing is free of charge at most venues. What we are recommending, because we understand that September 30th is almost upon us, we're asking that any of our staff that have been vaccinated, please take a picture of the front and back of your COVID-19 vaccination card. And I know later in today's meeting, folks are going to talk about how that information can be uploaded. We're asking staff that have not been vaccinated to please give very serious consideration to getting vaccinated. Now, you know, your options are the Pfizer vaccination, which is fully approved and has 2 shots, the Moderna shot vaccine, which is 2 shots, and the Johnson & Johnson, or Janssen, as it's often referred to now, vaccine, which is 1 shot. They're available to the Delaware Department of Public Health, most local and national pharmacies, and numerous curative pop-up vaccine testing sites. For those of us on the call outside of Delaware, Curative is the agency that is doing the vast majority of the pop-up testing and vaccine sites in the state of Delaware. We do have, and doesn't look like it made it onto the slide. We do have a website, Sherry, that I can, maybe get to somebody put up. Oh, there we go. There's some national websites. There's also a Delaware website of where the vaccines are available. When I'm done talking, because I can't multitask, I'll wind up hanging up. We'll get that posted so folks can see where it's available. If you have any questions about the vaccine, please refer to the CDC website, your local pharmacist, your primary care physician, and know that, again, the vaccines are ready available. They're free of charge. And they're available in any pharmacy you go into, as well as the Delaware Department of Public Health and all the curative pop-up sites, which are pretty much scattered throughout the whole state. Sherry, did you want me to look at the questions that were submitted and see which of those I can answer also?
Why don't we keep going? We'll have Alicia do hers, and and Tara, and that's going to cover some of them and the ones that don't get covered. If you could put that site in the chat, that would be.
I added it, Sherry.
Oh, thank you.
Thank you, Tina.
Thank you. So I'm going to move the this back to the Philadelphia update and ask Alicia to take herself.
Thanks. Thanks, Sherry. Good afternoon, everyone. For those of you that I don't know, my name is Alicia Smith, and I am the Chief Human Resource Officer for RHD. So as Bernie and Sherry have both shared, we're here talking about two of our areas or locations regions where we know we have vaccine mandates. There are other areas of the corporation, other states where they've had testing requirements. And so we are rolling this out following, initially following where there are mandates and orders that we have to put in place that we have to implement. So that's why we're talking about these two, not that there are not other areas. We've talked about some of the other areas in terms of testing mandates, but we're bringing this information to you as it unfolds. So that's why you're getting this information. As Bernie said, more information will come as we get updates. We will share them with you as well. So for today, I'm doing the update on the Philadelphia mandates. Some of you that have been on this COVID town hall for the last 2 weeks or the last two meetings have heard us talk about this. You also, Internal Communications released an email that had the Philadelphia ordinance attached from the Department of Public Health. So if you have any questions, that email also has the actual documentation from the city that has led to RHD's need to implement this and follow up on this order. So just kind of giving you the why. I'm not sure. There we go. So we talked about it. I'm not going to get into all of the details, but it's important to know a few things. So what are we talking about? We're talking about the fact that anyone living in the city of Philadelphia, anyone working in the city of Philadelphia, including employees, contractors. So I know that there was a question around agency staff or contract staff. Understand the ordinance covers employees, contractors, students, interns, or volunteers. So yes, and yes, and yes, and yes to the questions that were already posed. If they fit under this category, the answer is yes. Anyone that provides services where our consumers could be present must be fully vaccinated October 15th. So again, fully vaccinated, you guys understand, Bernie just said it, the 2 shots, either it's Moderna, Pfizer, and or the single shot Johnson or Janssen. So that's what we're talking about. Just want to make sure that whether or not you are working directly with consumers, or if you are administrative staff that are working in an area where consumers are accessing, that you also, this does apply to you as well. So if you are working on site where consumers can access that space, this does apply to you. So just wanted to make sure. If you are not able to be vaccinated, this order does allow for an exemption. That information will be also forthcoming. You're going to see a demo on the vaccination system that we are the system we're going to be using to capture vaccinations in a few. We are also working on one to submit exemptions. And we will have that available as well within a few. And if there's any other questions in terms of the ordinance itself, want to make sure that everyone knows that there will be the opportunity to apply for or request a medical or religious exemptions, but exemptions are not guaranteed. So we want to make sure that we say that when we get to that point, we'll show you that system. And we also will be required to retain these systems, because this regulation is something that the city will at some point audit and potentially check with providers to make sure that we are following. So more information is going to come. We just want to make sure that you guys are aware and are passing the word. In terms of your submitting of your documentation, you'll see in a moment, this is going to be a secure system that you're putting this information in. I know that that question has come through, where and who is seeing all of my information, so on and so forth. please know that we are at the same time as we're balancing the need to comply with government orders like we do in any other situation. We also are balancing the need to make sure that we are protecting employee information, that we are consistent, and in terms of how we are applying the mandate across the city of Philadelphia, as well as any exemptions. So we're working through those processes at the same time. The other thing is, I just want to make sure that everyone, because this question came in quite a bit, have we thought about the staffing crisis that we're experiencing with regard to this? This exemption, again, is something that the external world around us is requiring that we do. It applies to RHD employees. It also, what's not in there, which I forgot to put, was new hires. So anyone who is applying to come work at RHD, working in an area where there is a mandate, whether it's the Philadelphia, Delaware vaccine mandates, or whether it's one of the other states of testing, they are now being informed up front as they go through the process that this requirement is in existence and is in place. So I just wanted to make sure that I know a question came in, it doesn't apply to people who are being hired as well. And yes, we are always thinking about the staffing crisis and trying to come up with steps to address it. Sherry, so I'm going to stop there because I know that we have additional presentations I think will answer a lot of the questions that are coming in. If people will sit tight for 1 second, I think Tara can get through that, and then we can maybe go back to questions. Sherry, is that what you're planning?
Yep.
Okay.
Yep, that sounds great, Alicia. And so I think Tara and Mike are now going to walk us through some more information.
Yep. Thanks, Sherry. Good afternoon, RHD. For those of you who don't know me, I'm Tara Drennan and I'm your CISO. Over the past few weeks, we've been working very closely with our legal and HR teams, as well as our COVID committee and applications development team led by Mike Ryan, to develop a process for collecting our employees' vaccination information. In a few minutes, Mike's going to do a walkthrough of that form that you're going to use to collect the information. But before we start, I just want to go over a couple of things. The first is a reminder, as Marco stated and Bernie reiterated, this form is for fully vaccinated employees to upload their vaccine information. Fully vaccinated, as a reminder, is your second dose of Moderna or Pfizer have been completed, or you've gotten your first dose of Johnson & Johnson Janssen. The vaccine information form will be available later today. It will appear in Okta as a chiclet. The form can be used on any computer or mobile device, meaning you can access it through Okta on your cell phone, iPad, or any other device that you regularly use. Again, it will be available later today through Okta. The vaccine information will be validated using two methods for the information we collect. The first is we'll be taking a look at the lot numbers that you'll be providing as part of the vaccination form. Those lot numbers will be validated against the National Registry of Vaccination lot numbers to validate that they are indeed valid vaccine lot numbers. The second way they're being validated is through a random audit that we'll be conducting through our internal auditors. They will randomly generate cards to be reviewed to ensure that they are truly accurate vaccine cards. The information will be stored electronically. It will be secure, off-site, and it will have very limited access. Employees shouldn't have to worry that anybody in the organization can see their vaccine cards. It will be limited to a very few number of people who are required by their jobs to see these cards. Mike's going to go ahead now and do the walkthrough. And if you have any questions at the end, come back during the Q&A and we'll try to answer them as best we can. Mike?
Hi, everyone. Can you hear me clearly?
Yep.
Great. All right, let me share my screen and I'll walk you through the form. Okay, can everyone see my very limited Okta screen? So as Tara said, the form will show up as a chiclet on Okta later today. I have it just isolated in one little tab so you're not like looking at a bunch of clutter. So all you need to do is click on the chiclet. It'll open in a new tab. It'll ask you to sign in. So all you need to do is click the sign in. And if you are logged into Okta already, it will, which if you clicked on the chiclet in Okta, you already are, it'll go to Okta, it'll verify your authentication. If you're not already logged into Okta, it will ask you to log into Okta. So there's a brief there's a brief instructional page here that covers many of the things that Tara just talked about. That this form is only if you are fully vaccinated. That means that you have had two doses of Moderna or Pfizer, or you have had your 1 dose of Janssen, Johnson & Johnson. You will need to know, in order to complete this process, the lot number of each dose that you've received and the date on which you received it, and you will need to be able to upload your proof of vaccination. Proof of vaccination can include your vaccination card, a vaccination form from your provider, or the vaccination information from the vaccination registry. You will need to have a scan or a photograph of that proof. If you have a phone, you can take a picture of your proof, and then as part of the filling out the form, you can upload it. So when you're ready, you can click begin this form. You'll be asked to enter the employee number. This is the employee number for the person that we're providing the vaccination proof for. Ideally, this would be you're filling it out for yourself, or if you're assisting someone else with getting their information into the system, it would be that person's employee number. So I'm just going to enter a fake employee number.
Wait a minute, say that again.
So if you are filling this out on someone else's behalf, you have an employee that is struggling with or doesn't have a technology where they don't have a phone. For whatever reason, someone's just having difficulty, and you want to help them and do it on their behalf, and they're okay with that.
Okay.
This is all from you're entering all the information about the person that you're entering the vaccination record for.
Okay.
I'm also entering 5 9s because I don't remember off the top of my head what my employee number is. Hopefully the rest of you are better at knowing your employee numbers than I am. Then it's going to ask for your vaccination status. There's only one choice here, fully vaccinated. And then we'll click save and continue. And then we're going to enter some information about our vaccination, and we're going to also upload the proof of our vaccination. First thing you want to do is you want to select the correct which vaccine you have, Pfizer, Moderna, or Janssen, Johnson & Johnson. I received Moderna. There's an attestation here. This is this is basically you're confirming that you have received the full vaccination series for coronavirus protection. Once again, that's either 2 doses of Pfizer or Moderna, or 1 dose of Janssen, Johnson & Johnson. And I have. So I'm then going to go grab the image that the photo I took of my vaccination card, and I'm going to upload it. I don't know if you saw the file selection screen. Zoom's a little funny about that. But however your browser allows you to upload files is what it'll show up there. And once again, you can do this on either your computer, your laptop, your phone, your iPad, whatever. Then we're going to continue. And then it's going to ask us for the lot number and date of each of our doses. If you selected Pfizer or Moderna, it's going to ask you for information on both doses. If you selected Janssen, Johnson & Johnson, it's only going to ask you for 1 dose. So I'm going to enter a lot number. I'm going to select a date. And then I'm going to enter my second dose number. And I'm going to select my second date. And I'm going to save and continue. It's then going to come up and it's going to show you it's going to show you the information that you've entered to basically so you can confirm It'll show you the information you entered. It'll show you the file name of the image that you uploaded. And if you're sure that you've entered everything correctly, you can click submit form, or you can click at any point during this form. You'll notice this previous button over here. You can go back to the previous page if you realize that you entered something incorrectly, like, and you want to correct it, and then you can continue back through the form. And then we click submit form. And you will get this screen that says you've completed it, you finish your submission. It'll give you a reference number. This reference number is also being will also be emailed to you. You just heard my email notification. I think you just heard my email notification go off. And that is the only information that you're going to get back. You're not going to get back any of the information that you entered. It's all staying in its secure storage. But if you ever have any concerns and you need to follow up on it, you have that reference number to use. And it's as simple as that. The only difference if you had received Janssen, Johnson & Johnson is that you would have only entered one lot number and one date when entering your vaccination information.
Thank you so much, Mike. A couple of things. The first one is, if you don't know your employee number, you can find that on your Lawson home screen. As soon as you log into Lawson, it is right in front of you on your home screen. It says your employee ID as well as your name. So you can get the employee ID information from there. This is a reminder that this form should be completed by all fully vaccinated RHD employees, not just employees in areas where there is a current state, local government, or funder mandate in place for these. This, again, should be completed by all employees. This is for employee data collection only at this time. We are still working through the process for independent contractors and others we need to collect the data for. Please be on the lookout for communication around that in the next few days. But again, this is just for our employees. And the form will be available through Okta later today, probably within an hour of the end of this meeting. But give us to the end of the day today in case it takes a little bit of time to appear for you. You can fill it out for yourself or one of your employees with their permission if they need help filling it out. That's why we're capturing the employee ID on this. Other questions? We'll answer during the Q&A if they come through. I do want to touch briefly on the accommodation request process. As Alicia mentioned, the Philadelphia Department of Health is requiring that all employees that work in a setting where healthcare consumers are served either be vaccinated or have an approved exemption in place. That process is currently finishing being developed. We anticipate that you'll have a meeting invite if you're in the Philadelphia area this week to sit through another walkthrough demo. We'll also include that demo in our email communication so everybody can see what they have to have. The two exemption types available are religious or medical. For the religious exemption, the documentation and attestations will be provided by the employee only, and that will be a fully electronic form. For medical exemptions, it will be documented and attested by both the employee and provider. And there will be an electronic portion that the employee fills out and a paper form that the provider will need to fill out and be uploaded. The accommodations available if the exemption is approved. As Alicia stated earlier, not all exemptions may be approved, but if it's approved, there are two accommodation types. The first is masking and testing, where you'll have to wear a mask and be tested. If you're in the office 1 to 2 days a week, you'll get tested once a week. If you're in the office 3 or more days a week, you'll be tested twice a week. Proof of testing must be provided as part of this process. And then the other accommodation is telecommuting if applicable for the role. We aim to have all accommodation requests that we have been approved by the date we indicate later this week by October 15th, and communication back to all employees in a timely manner. We are just working on finalizing the legal language and requirements, as well as the last pieces of the exemption requirement. know that those forms and that information will be available to all employees this week. We are just waiting to finalize the last few steps to that. Thank you for your patience. I know many people have been waiting very patiently to see the exemption forms. Know that we are working diligently on them. They are coming and they will be out this week. Again, the religious exemption will be fully electronic and online. It will be a form very similar to the vaccine process you just walked through. And the medical exemption will have a paper component as well as for your provider to fill out, as well as an electronic part for you, the employee, to fill out and to upload the information from your provider. Again, there are additional questions. We will be happy to answer them to the best of our ability during the Q&A. Thank you all. Sherry?
Well, we are now at the Q&A. So what I'm going to ask, timing is perfect, Tara, that Mike and Tara, there's a number of questions in the chat that directly relate. So if we could start there, I just want to give you a second to take a peek at those.
Jerry, if I could jump in real
Please.
quick as
Please.
Tara and Mike get their thoughts together. There were several questions that were raised in the chat early on, and I think it's important to ground us as we go through the Q&A. Right, there is some question around what is RHD doing in regards to dates, and is there a mandate across the country? There are questions around the federal direction that we heard about on Thursday and how that is correlating with the mandates that we're seeing in Philadelphia and Delaware. So I want to share that, and we'll start with where is RHD. So again, as a larger organization, we have over the past few weeks have been determining how are we going to proceed as an organization in ensuring the health and safety of the folks we support, as well as our staff and their families, through utilizing vaccines and/or testing. And at the same time, we are starting to see and hear and understand the various mandates from the various government. We have not, as an organization, sent out any specific communication around the path that we're on. I'm sorry, any requirement that we are making for everyone across the organization. So there is no RHD mandate for vaccines at the present time. What we have shared and what I will continue to share with you all is we can see the writing on the wall. We understand where government is going. We are seeing where government is going. And as I mentioned in my opening, the requirement of vaccines is across the country is in front of us. I think that with that said, it's hard at this moment to answer any questions relating to, well, what if I'm not vaccinated? As we can see, and understand where government is going, their response to individuals that are not vaccinated or that cannot be vaccinated are varied right now. So we're going to continue to proceed as an organization to do what we feel is important to do, not only with the health and safety of those that we support and around us, but also given all of the other challenges that we have as a provider of human services, a provider of people serving people, particularly a staffing crisis. With that said, we know that on Thursday, the federal government has begun to communicate their intention to provide mandates that we understand will be applicable to us, being an employer of 100 employees, of greater than 100 employees, as well as an entity that receives Medicaid and Medicare funds. The details of those mandates have not been determined. So none of the details around what those mandates are going to require outside of a vaccine and what any exception process may look like, none of that has been determined by OSHA or CMS at this time. So we don't have that insight. What we do have and what we are focused on presently is ensuring that we are complying with the City of Philadelphia mandate as well as the State of Delaware mandate. And as you've just heard, we are also moving us forward and capturing the proof of vaccination for any employee that's been fully vaccinated. So I just want to sort of frame that for us all. Hopefully it was helpful. And maybe before we go into questions, we can see if there are any specific questions around where we are, the landscape that we're working in, and what we're trying to accomplish as an organization, as and within in the city of Philadelphia and Delaware. Are there any specific questions before we proceed with some of the more specifics to the mandates?
I see 3 new questions came in, but I haven't had a chance to look at them.
I just saw a thought that, a question, there are mandates in Philadelphia and Delaware. Yes, that we have to comply with. There are no mandates that I'm aware of. I would ask others to chime in any surrounding counties in Pennsylvania or in any other states, but I would ask others to chime in so we're sharing accurate information.
Marco, the only thing I would add is there's no mandates in the surrounding areas, but if you are working in any of our Philadelphia program locations, no matter where you live, the mandate applies to you.
And there are some mandates in the state of New Jersey for large long-term care facilities, but it does not, our staff and the programs that we're currently running in Jersey, it is not applicable to us there.
Yeah.
And just to be clear with Delaware, the target date for Delaware is September 30th. The October 15th date is Philadelphia. The other difference so far between Delaware and Philly is from the information we have so far in Delaware, there is no accommodation for religious or medical exemptions. Again, we don't have all the details yet. It's either fully vaccinated or weekly testing. We do have our advocacy group, the Ability Network, meeting with Secretary McGarrick, the Delaware Health and Social Services Secretary, and we as one of the providers in that network have supplied questions and will continue to do so as we try to help our friends in Delaware formulate and get the guidelines out to us.
So there was a question in the chat regarding if this also pertains to participants. Again, what we are referring to and working through are mandates specific to our staff. There are no mandates, and again, I would ask others to chime in, that require our participants to be vaccinated.
So Marco, I can respond to that too. There are no, around our participants, there are no requirements right now. And again, there's the, back to the Philadelphia, what if I live in Philadelphia and work in a surrounding county? It does not apply. It applies, the mandate applies if you are working in Philadelphia.
So the question, I'm sorry, Bernie, was that you? All right,
It wasn't, but Linda did, it's a good point that Linda just made. The same would be applicable in Delaware. If I live in Pennsylvania, but work in Delaware, the mandate for Delaware will apply. The mandate is based on where you work, not where you live.
Right, and Sandra, your question is a great one, and the easy answer is yes. And I think for any further conversation of that question, I would ask you to work offline with your program leadership to get the information that's needed. The question in regards to needing clarification as to RHDs not mandating vaccines. And I think that's I want folks to hear what I'm sharing as clearly as possible. RHD has not taken a position at this present moment where it is requiring or mandating vaccines. However, as a provider of service in various jurisdictions around the country, states and local jurisdictions, and as well as a recipient of federal funds, we need to be compliant with what our government funders are requiring us to do. So within the city of Philadelphia, within the state of Delaware, we are required to mandate vaccines. So we are doing so in those areas and will do so in any other area that requires vaccinations as we move forward. I'm hopeful getting some of these questions out is good to get us grounded as we move forward in some of the specifics. Because I think it's important that we all understand what are we talking about and does it pertain? Who does it pertain to? But even if you're not working in the city of Philadelphia, and even if you're not working in the state of Delaware, much of what we're talking about, we could begin to anticipate not only the federal guidelines requiring, but also other states and other local jurisdictions. So good information and insight to be aware of and knowledgeable about.
So if it's okay, I would want to address something about the federal guidelines, just so that everyone, again, another grounding is that what has come out is federal, is kind of like an alert, a heads up as to a direction that we may be going in federally. It is not an actual passed executive order or mandate as of right now. So I just want to make sure that we're all clear that we are not currently operating, there is no current federal mandate, that we're all paying attention to it. We're all going to be paying attention to the challenges. You know what happened with FLSA, and we ran out of the train, got it off down the track and implemented it. And then there were appeals and we saw what happened with that. So again, we need to allow for this to unfold as it goes along, and we will be paying very close attention. We've got plenty of qualified and competent staff that internally that are charged with that. People from legal, people from HR, people from benefits are all paying attention, risk management, all paying very close attention to what's coming forward, because that's what we're supposed to be doing. That's our work to do. But we're also paying attention to guidance from external sources as well. So many of us are connected in our own networks, are part of associations and affiliations. So I just kind of want to let people, let people know that we're paying attention to it. I don't want everybody to feel like they have to continue to forward the latest CNN news alert that they got to us. We are all getting all of those same things. We're getting them from all of our legal entities, from our HR entities. We're getting them from every imaginable corner of the earth. So I just wanted to make sure that everybody had that assurance that we are looking at this multiple areas of the corporation, multiple teams within the corporations from different vantage points, and also getting additional insight from external experts that we partner with on just about anything that we do. I know that I do, as well as I know Stephanie and her team and June, as we often pass that information around each other. So I just wanted to kind of put that out there because I saw quite a few questions about the federal mandate. If in fact there is a federally ordered mandate, in any order, understand when it comes to at least HR laws, in most situations, federal mandates trump anything else. A local has to fall in line. It can exceed, but it cannot do less than what the federal rules require. So, it's like RHD, we could always do more than our funders ask for, but we do have to comply with what our funders ask for at the very minimum. So I just wanted to kind of put that out there to maybe address and alleviate right now the questions around the federal, the president's most recent announcement. Know that it is still new, it is still fresh, and it is still yet so much to be determined, so much unknown. Sorry, Sherry, go ahead.
No, that's fine. No, that was great. I think what I'm taking away is, we're answering what we can, but things are still becoming clearer. And so I'm wondering with that, if we can go back and answer some of the questions about the portal, since we have Mike here And we can actually maybe answer some of those since we have a sphere of influence over that. So Mike and Tara, I'm hoping you had a chance to look at some of those questions and we'll be able to respond to those.
Sherry, I'm hoping you're going to ask us the questions because there's a whole lot in chat. So I'm hoping somebody has the questions for us.
Yep, I will go back up to those now. I think Mike even restarted. I think I saw one response. Mike, one that I remember seeing was about, can I get the chiclet, right, if I'm not on my computer? Do I have access to that? Do I need to take a picture of the front and the back of the card? I think that's how you say just the front. There is another one. Let me go, keep going back up.
If you have questions about the vaccination form that we're not asking, go ahead and jot them back in the chat so they can be fresh in our minds right now.
Here, where is this located again? Is it rhd.org?
Yeah. So it will be available on Okta. The chiclet's not there yet, so don't go scrambling to Okta right now. But it will, as Tara said, it will. We're going to put it up after this meeting. Give us until the end of the day. Sometimes it takes a little bit for the chiclet to get out to everyone. Yes, you can use it on your mobile device. The form works very well in a mobile environment. And when you're uploading your if you're uploading a picture of or scan of your vaccination card, you only need to upload the front of it because that's where your actual vaccination information is.
And one more that I'm seeing that was from a while ago. I may have missed this, but what about independent contractors or interns? How do we document their status?
Yeah, so for this form is just for employees. We're still working on the process for independent contractors and interns. We will announce what we're doing to collect that information to everybody as soon as it's available. I just want to give everybody a reminder. Okta is the place you go into every 2 weeks to fill out your loss and time cards. It's how you get your email through the web. It is rhd.okta.com is the website. You should all be familiar with it because I know we all like to get paid. So I know we all go into Okta for at least that. So that's one reminder I want to give you all. I've seen some other questions, Stephanie, about reporting. Yes, reporting will be available for managers so that we know where appropriate, which employees are vaccinated or not. So in areas where there's mandates in place, that reporting will be available for our managers to go through and review.
So one question that I'm going to take from earlier on is, will this specific demo be available as a recording? Yes, Sarah and I have already been chatting and talking about creating an edit so that we can use this as a demo. I'm thinking we either send it out or put it on Cornerstone. There's a question, again, I haven't gone down to the new ones yet. This only explains for vaccinated staff. What about unvaccinated process? So that's a little bit now on another topic. So let's just see if we can, is there any more about the, I'm going down to the new ones. Looks like all of the newer questions are very specific to vaccination.
So Sherry, the process we walked through was for vaccinated. We talked through the process for Philadelphia exemptions, as that's the only place that we operate in at the moment that is talking about an exemption process. We talked through that process on what to expect. We are not collecting additional information at this point in time about unvaccinated statuses. We are only collecting information for fully vaccinated employees, and we will be collecting information for exemptions starting later this week. Specifically exemptions for the city of Philadelphia, to be clear.
So it does look like we have finished the questions that are related to the portal, but we certainly have a lot of other questions in the chat. Many of these are similar to questions that were also previously submitted. I'm wondering if we can go to the previous submitted ones, and then if we don't capture anything in the chat, I'm trying to look at both. It's hard to go back and forth. And then we can try to capture those. So Sarah, I'm going to ask, since you have the document with the previous submitted questions as well, if you could start with some of those while we look through these questions.
Sure. Some of these have already been answered. I know it says that anyone who is not vaccinated will not be eligible to work. And I believe these people are specifically talking about Philadelphia mandate, and will not have access to property where consumers also have access. But can you please provide some clarity? Does this mean that staff will be terminated or laid off effective immediately on October 15th if they choose not to get vaccinated?
So again, I think that there has been for Philadelphia employees, for employees who work in Philadelphia. So I'm going to speak out, and then Bernie can speak from Delaware. If you are not able to be vaccinated, you'll be asked or required to submit an exemption. There's only two options. One, submit your vaccination information, or two, only two, or submit a request for an exemption that meets the criteria for either a medical exemption or a religious exemption. There will not be an opportunity for a choice of, I'm just not going to get vaccinated and still maintain employment in those particular areas, because that's not what is we're not being offered the opportunity to do that as an organization. So you'll either need to submit an exemption, or you will need to submit your vaccination information. Now, let me just also say that there are some, there may be some programs where, we work with a particularly medically fragile population, and we may have to, you may not be able to, even with an exemption. That's what we said, it's not a guarantee. It depends upon the site, the location, the work that you do, whether or not that exemption would be eligible, but that would be something that's known and determined based on the program itself. Delaware, Bernie, my understanding is the same. You don't have the ability to make the choice not to get.
Right. If with Delaware, since they're currently not making any exemptions available, the choice is either to be fully vaccinated or to go through the weekly testing. If someone is not fully vaccinated and chooses for some reason not to go through the weekly testing, then they would not be eligible to work past September 30th. What their status would be, we have not quite yet determined. Again, we are anxiously awaiting a promised regulation from the state. We don't want to make a ruling without some further, input from our funder. As soon as we get that information, we will pass it on to folks. But know that what we do know is, as it stands now, as of September 30th, you either need to be fully vaccinated or go through weekly testing to be eligible to work.
Thanks, Bernie and Alicia. Sarah, do you want to keep going? I don't know if it's better to go to testing. I do see a lot of testing questions, or stay in that category.
You know what, let me ask one more about vaccine mandates, because this one was also asked in the chat.
Great.
So people are curious, and I know specifically, and I hope this is clear to folks, that when we're talking about vaccine mandates, we're talking about what's happening in Philadelphia and Delaware specifically, okay? So when people ask questions like, can remote, does this apply to remote staff who never end up going into a site where there's a consumer? We're talking specifically about Philadelphia and Delaware for these two mandates that are coming up. So I'm wondering if someone could address the remote staff question. I know it was asked in the chat also.
So, Sarah, I appreciate the clarity that you just provided, and I think it's important to emphasize again that, you know, the conversations that we're having right now and the particulars that we're speaking to in terms of exemptions and ability to work is specific to Delaware and the city of Philadelphia. So to the question of what about remote workers? So to the extent that someone, the mandates in the city of Philadelphia and Delaware currently apply to staff working in Delaware and the city of Philadelphia in healthcare settings where they will be in direct contact with individuals receiving healthcare service, and if not in direct contact, in addition to also indirect contact. So, you know, two examples I would share with you. The easy example would be many, if not all, of our program facilities where we provide services directly out of those sites to individuals, and those services being healthcare services. There is no exception within our services that any service is not healthcare. All of our sites and facilities are healthcare facilities where we're providing healthcare services. Whether it's residential services or outpatient services, again, those facilities would require are applicable. The mandates are applicable to those sites. The other example I would share with you is 4700 Wissahickon. 4700 Wissahickon, as we all know, is not only our corporate office, but also houses many of our program offices. And many times we have individuals walking through our space, the individuals that we serve that come and visit our space. So we are considering 4700 a site that is requiring, that is mandated by the Philadelphia mandate as requiring vaccination or exemption. However, if you aren't working out of 4700 or you're not working in a program site, then again, the mandate does not pertain to you. Again, you know, I think that there is a need for us to be thinking about right now what we must do, and also as we continue down this path together, layer on top of that additional steps as we get some of these requirements grounded. So for our staff, our corporate staff, or even if there are any division or administrative program admin staff that are still working as they have been 100% remotely and have no need to come into our administrative spaces. And that's the key. Have no need to come into our administrative spaces. The City of Philadelphia mandate would not apply to you.
And can I just add, Marco, that your managers or supervisors will also go over that information with you?
Thank you, Sheena, because I'm certain what I just said just added another layer of confusion.
Yeah, so if you have any confusion, if you've been working remotely this entire time or confused about anything, if you're needed, if you've been working remotely and are needed to, and this mandate applies to you, your supervisors will talk. Either way, they'll talk to you, but they'll communicate this information with you.
I would say the same would be
Sherry-
true in Delaware. If you have, if you have questions about whether or not you are, you know, able to continue to work wholly remotely, or if you have to come into the office on occasion, please address it with your immediate supervisor.
And Sherry, before we move on, if we could just go back a couple of questions, just for Brandon and I to add a little bit of context, because there was a lot of questions, and understandably so. What happens in Delaware on September 30th? Who can still work? What happens in Philadelphia on October 15th? And as Alicia had stated, by the 15th in Philadelphia, you either have to be vaccinated or have an approved exception, or the law, the mandate that we have says you cannot be working. And we really just wanted to take a minute and talk about how all of us have struggled over the last year or so with staffing shortages and the reality of that. And so this may or may not be difficult, but we wanted to just, put that out there and start having the discussions right now. Pretty soon we'll be able to start loading the information on how many of our staff are vaccinated, and then really work program by program on what does that mean for the staff in that site on October 15th. Brandon, if there was anything else you wanted to add to that.
No, I appreciate you acknowledging. I think we understand that it probably is not going to be easy, but the one thing that Alicia said, and I think it's important, Marco, I think also addressed it, is that everybody in our community is going through this, right? Specifically with Philadelphia and Delaware, other providers who would be our normal other pools where folks may say, I don't want to do this with anymore with RHD. I'm going to go to another provider. You would face the exact same challenge at another provider. So short of someone, unfortunately, we hope this doesn't happen, but we are seeing it, where folks sort of give up hope and say, I don't want to be in healthcare anymore or human services. That may happen. And we just pray that doesn't, because we need good workers. We need people to stand up like you have, like our teams have. So just want to encourage you to let your staff know we are, again, this is not an RHD mandate. This is a jurisdictional mandate. This is not a federal mandate yet, but if it develops, we will have to step in line. We will follow a mandate if that's the case. We'll do our best to support our workers and support our clients, but we will have to follow those jurisdictional mandates.
Yeah, so just to be clear, I know some of the questions here and that we got through my voice were very specific, like, do I lose my job? Or what if I have one part and not my second part of the vaccine? And you're saying we don't know the answer yet. This is what we're trying to figure out. I'm asking for, just to make sure we're all clear, because I think that's really what folks are asking and have put in writing.
So Sherry, I can respond for Delaware. Although we have been told in one of the updates from Delaware that as long as you have your first vaccine by September 30th, you're okay, we can find nothing in writing, and we have posed that question, and now, quite frankly, are sort of getting crickets back from our funders. It is one of the questions we have asked our advocacy group to take to the secretary in the meeting tomorrow, because it's a huge question. It makes a big difference. So we are going to go, we have to go with the most stringent, saying that right now you have to be fully vaccinated. And again, I'm not trying to advocate for any one vaccine over another. I'm just making sure that folks understand that the Johnson & Johnson / Janssen, that's a one-shot vaccine. There's not 21 or 28 days in between. But as it stands right now in the state of Delaware, we have to go with the more stringent interpretation, and as you have to be fully vaccinated prior to the 30th. As soon as we get any feedback from the meeting with the secretary tomorrow or anything from the governor's office, we will share it out with folks.
Bern, I would like to just make one. Oh, I'm sorry. Go ahead, Alicia.
Oh, no, I was going to explain what Bernie just said for Philadelphia, but Linda, will you get ready to expound upon something for Delaware before I?
Well, yeah, just one piece for Delaware. If you're not fully vaccinated by the 30th, you still have the option to test. Delaware is very different than the Philadelphia mandate. So I just wanted to, for those in Delaware, remind people of that. And then go ahead, Alicia, about Philly.
Yeah, I'm glad you said it because I wanted to make sure that everyone was clear. So again, there's a couple of issues. One, what is Philadelphia allowing? And I also want to address the question that keeps coming up. Why aren't we testing vaccinated folks? Again, the statement that follows it is true. We understand that vaccinated folks can still catch COVID. That is not being required. Again, we are following what the ordinance in Philadelphia that has been passed. This email, just to remind everyone, I believe was sent out September 2nd. If I'm not mistaken, it was a corporate-wide email, or is Philadelphia staff only? I don't know, Sarah can clarify, but it has the actual ordinance from the city attached. I highly recommend that everybody, whether you feel like you can understand it or not, just to read it, because some of us, there's different learning styles. So you're hearing it and you saw the slides, but if you actually read the ordinance yourself, for some people who are more visual learners, which is what I am, I can't absorb it just from hearing it. It will help you if you can read it. It may help some of this is the first time you're hearing this to make a little more sense for you. But when it comes to the Philadelphia ordinance, just as Bernie shared, what's in writing in that ordinance says fully vaccinated by October 15th. Now, we've gotten word, although it's not written in the ordinance, and so word can come and go, but we've gotten word that if our staff have had both shots by the 15th, there may be an opportunity for us to still have them work because we know they've completed the shots, and then we are allowing the alternative while they're waiting for that 2-week period post second shot to pass, or post the first shot, the one and only shot to pass, that we can follow the other protocols that are in place. So there was a question around why can't, in Delaware, you can be tested as an alternative to vaccination. Philadelphia is not allowing that unless there is an accommodation that is submitted and approved, that's the medical or the religious accommodation. Only then are we required to test twice a week. And they haven't said which days, or, they said twice a week. So for full-time staff working multiple days, somebody put a question, what if I work 5 days a week? How many times? If you come into a site more than 1 day a week, you will likely be tested more than once in that week. So just to kind of put that out there. Again, we're still working through all the details of when and how and all of this tracking, as Tara said, in terms of the testing aspect of this. But Philadelphia, let me just say it again, Philadelphia is not allowing testing as an alternative to vaccination. Delaware is allowing testing as an alternative to vaccination. Philadelphia is not. Philadelphia is only allowing vaccination and proof of thereof, or an accommodation that has been documented correctly and approved. And therefore, we then move into the alternatives for accommodation. Know that that accommodation also comes with other requirements. If you're granted accommodation, you must be must test twice a week. You must double mask. There are some other requirements that are there for you if you are granted an accommodation in Philadelphia. It does require some additional things, but testing as an alternative is not available to Philadelphia programs. I see you, Leslie. We'll make sure we get that to you again. This is applying for people who work in the city of Philadelphia. So if you are not working in the city of Philadelphia, you may not have gotten that email. If you're inquiring and would like to receive that email, I see a couple of chats directly about wanting that. Again, it only applies to those who are working in the city of Philadelphia, but you can forward that to you if you just want something for your reading pleasure in the middle of the night when you're trying to go to sleep.
Just to be clear, on Friday, we did send out an email to all Delaware staff, listing the information that I shared today. And we plan on doing, as we get any verifiable updates, we plan on doing that again. And we did ask in the email if you think we missed anybody, to please share it and also talk to your coworkers about it, because we know a lot of folks hit the ground running for their whole shift and don't have time to read their emails. So we're trying to get the information out through as many venues as possible.
So I do want to acknowledge that we're probably not going to get to all the questions. We will definitely save them and put them into categories. We're clearly going to need either a follow-up conversation or communication. So I feel like I'm feeling frustration in the chat. I appreciate it. I hear you, and we're doing our best. But I do want to commit to that we will get back to you, if not today, in some other form of communication. Sarah. Yes, I see I thank you. Maybe we can just take some that are in the chat that we know are also in there. Well, here's a quick one. So for working in Montco, what applies?
So I'll take that. The mandates right now are Philadelphia and Delaware. If you are working in Montgomery County, the vaccine mandate does not apply.
Gonna try to go up a little bit. With an increased demand on testing sites due to increased cases and now mandates, what will happen if you are unable to get a test done each week? Are home tests also being accepted? I think who's taking the testing questions?
I don't think we have them assigned, but I'll take this one real quick. We are working through what our testing protocols are for everybody. I would anticipate that in our next town hall, which is going to be the 27th, which is ahead of testing requirements in any of our jurisdictions, that we'll have a similar walkthrough that we did for vaccines about testing on the 27th. So if you could be patient with us for a little bit as we finalize those testing requirements, how you'll upload that documentation and proof, where you could go. We promise we will communicate it as soon as it is available to everybody. But for today, we do not have the answer to that question. And we are actually working on that in part this afternoon. We have meetings on our calendars for today to continue that conversation, develop that next set of forms. We are trying to get the forms ready for everybody in time for use. And that one, unfortunately, for the questions coming in today, come after our vaccine collection form and our exemption request form. So just hang tight for a little bit longer, but we promise we'll get it to you.
Thanks, Tara. This is a question that I see in the chat, but was also sent to us via email earlier. Is there a reason why vaccinated staff are not being tested? Doesn't studies indicate vaccinated individuals are just as likely as an unvaccinated person to contract and spread the virus? And that is why there are these breakthrough cases due to the lack of being tested.
Yeah, Sherry, that's the one I just spoke to, where I said we are following what government is requiring. That is true, but that is not what we're being required to do right now. We do have protocols. June and Brian have talked about our changing protocols with everyone's mask when our HD premises. I know that they spoke about that last week. I don't want to steal their shine. They can maybe talk about that again. For anybody who might not have been on the last time we met, I believe those updated protocol, I don't have the date. I have so many different dates in my head. Are they on, June or Brian?
Yeah, thanks, Alicia. Really, just to address the breakthrough, the science has indicated that the breakthrough cases are happening because of a very large unvaccinated population. So that's why Biden has sent out some information on that to try to get more people to be vaccinated. In the meantime, we did not have a corporate testing mandate or policy. We were using those testing situations to either confirm COVID cases or when people would come back from a travel situation where they were required by regulation to have that done. As you know, the testing is for that time, snapshot in time only. So that though it might be helpful, it's a extra resource that right now we are requiring the vaccine. I mean, not requiring, but trying to encourage the vaccinations because that is obviously much more effective. And addressing the mandates that are coming through with the particular regulation. Obviously, those people that have exemptions, they'll need to test. That's part of it. Part-time, less testing, full-time, more testing. But the other protocols that we've recommended, the masking when you're in a situation, in most of the sites now, masking is required because we're not too sure of vaccination status. So mixed environments require masking. People who are unvaccinated, they're recommending double masking, hand washing, keeping socially distanced. All of those things factor into keeping a safe work environment.
Thank you. I think, Sarah, we're going to try to get one more in from you.
Yep. So a lot of, I'm just going to kind of summarize a few questions we've gotten about the same subject. People are asking what kind of things, specifically like a religious exemption, what kind of things may come into play for someone to not be able to receive a religious exemption. And maybe we don't have those details yet, but maybe someone can speak to that. Like, why would someone be turned down for an exemption?
Brian Joel, I don't know if he can be unmuted, but I know that he has looked into that, as well as Diane Falcone from legal. So, but I think they're muted, so they need to be.
He's unmuted now.
Okay.
Yeah, I'm unmuted. Hello, everybody. So in terms of a religious exemption, and we do need to still look at more information, but as it relates to things now, to be exempted for a religious purpose, you have to show that you have a sincerely held religious belief. In doing that, when you provide your exemption, you have to tell us what the exemption is, what the religion is that you follow, and why it won't allow you to get the vaccine. So that's the state of things now. We will have to look more into these things, but that's what the exemption is now. I don't know if I'm answering your question directly, but that's what the exemption requires now, for you to determine or allow us to know what your sincerely held religious exemption should be.
And then maybe
Thanks,
Linda could talk about just some specific programs and needing to be just vaccinated to work in those programs. I don't know, Linda, if you want to talk more about that.
What we're looking at, are there programs where we serve people who have a higher level of medical complexity, that we would make that exemption required for all staff there? So that has not been finalized yet, but that is something under consideration, that for those that by definition have a medical fragility to the care that we're providing, that may be something we're considering. So we can, update very soon on that.
So I'm just gonna, lots of things to update you on and get clearer about and get back to you. I'm just gonna ask everybody to take one of those nice big deep breaths in. I'm taking one myself and out. And let me pass it to Marco for some closing remarks.
Thanks, Sherry. And I appreciate, Sherry, you asking us to be mindful of where we are by taking those breaths. I think it's extremely important that we all do that. And remember that we're all working through this together, and we will work through it together as we have for the past 18 months or plus. There's much in front of us in order for us to ensure that we are remaining flexible and reasonable, but also making sure that we are complying with the local and state mandates that are in front of us. So as we learn more and as we determine our paths, we will continue to share where we are with this group as part of this call. But we also ask each of you to take back what you've learned today to your teams and make sure that folks are informed about where we are as an organization and the path that we're going down. We will also create some communication this week as well to further clarify and provide clarity to all, so that way that can aid you all in your communication with your staff and with your teams. But let's not negate the communication that's already occurred and the importance of us working together, talking to each other to understand this further, while we also wait for the written word. So with that, again, I appreciate all that have participated today. I thank Sherry and Sarah for their efforts in trying to get every question posed, asked as best as we could. And as Sherry shared, we will send out some communication, either the responses to the questions or how we will ultimately respond to those questions that have been unanswered in a way that folks hopefully will find effective. So stay tuned for more. Take a deep breath. and continue to talk with your leadership and others so you have the information that you need. Have a great day, everyone.